Guys, welcome back to Medical Coding with Blue. Today's episode is all about the best specialties for new medical coders. If you are brand new to my channel, welcome. I am Blue. I'm a medical coder. Okay, guys. So, if you are brand new to medical coding and you're out there applying, but you don't really know where to apply, I will say this: you should be applying to every place that is hiring for medical coders. Okay, regardless if they're asking for experience or not. But if you are wanting to be a little bit more selective about where you're applying, maybe you are in a position to be able to have that time to be able to do that. These are some of the best places for new medical coders to start working. Now, my version of best places to start versus somebody else's is going to differ, because for me, the way that I look at it and the best thing that I have found when it comes to learning in medical coding is that you get through the harder places to work first. If you are trying to get in, oh, so easy, and let me do risk adjustment because it's just diagnosis coding or very few other selections of other codes, no. Because what's going to happen is you're going to get a false sense of confidence working in a place like risk adjustment, because yes, while you do have to know pathophysiology very well, one of the things that a lot of people don't say, but you do have to know that very well. But again, it's just diagnosis coding. And so that's where we need to kind of break out of that, because when you expose your brain to a more wide variety setting that's going to give you that experience, you're going to find yourself strong in not just one subject, not just one specialty. It is going to be multiple specialties. So the places or the settings that I'm going to be telling you guys to get into today to start really looking for those kinds of places to apply, these are going to help get you exposure to everything. When I first started at a cancer therapy research center, which cancer coding, oncology coding is some of the most difficult coding to get through, because you have to kind of like have in your mind what's actually happening, because there's a lot of words when you go primary and metastasis and all these other things, and you have to really figure this stuff out. So coding for oncology is great. The thing about oncology coding is that you touch on not just one of the more difficult specialties in coding, which is oncology, but you will also get exposure to different types of specialties, because cancer patients also have skin problems, right? Because the therapies make their skin very sensitive. So sometimes you'll see those in those notes, okay? There's also it takes a toll on them with their mental health. So you'll also see those codes as well. There's a lot of things that happen, okay, in coding for cancer therapies. And so that's one of the best places that you can start. The other great thing about coding for oncology is that they do have more specialized credentials, which you could totally do that. A lot of people ask me, what do I think about getting like cancer registry? They want to go into that. Absolutely, because there are some facilities that is an absolute necessary. Somebody has to be certified in cancer registry in order to work there, so that facility stays compliant. So having something like that is a really good feather in your cap. I mean, that is the one thing that I will say, that when you are starting out and you spent your 2 years with the one certification and you want to get something additional, if you wanted to get into cancer registry, that would be one of the best things you could do for yourself, because then that wields a little bit more power, because again, you have a bargaining chip. Some of these places are going to require somebody with your credential. So if that's something that you're interested in, that is definitely a path that you could think about, okay? But starting in a cancer therapy center or a place that you're going to be coding for oncology would be a great start, okay? So that's one of the best places, that you can go, and that's going to give you that wide exposure without you feeling like, oh my gosh, I only know just a little bit. No, you touch on a lot of things, okay? So that's, again, a great place to look. The other place that I will say is, of course, the emergency department. If you are coding for the emergency department, what better place, right? Everybody always calls it the Wild Wild West. It is the Wild Wild West because the ER is open 24 hours a day. You are seeing everything, okay? Now, be careful because sometimes in some of these ERs, it depends on where you're working. Some of them only want you to code for the diagnosis side of the house. If that's the case, that's not the ER position for you. There are other ERs that you can go and apply because trust me, that is the one specialty that is always hiring them and orthopedics, but we'll get into that in a minute. But starting in the ER and getting that exposure where they are having you check or audit or apply the E&M codes for the ER and coding for the procedures that do happen in the ER, like say, for example, the hydration procedures. So those are things that happen in the ER. You can get a wide variety of specialty knowledge just being in the ER because you're doing evaluation and management, you are coding for minor procedures, you are seeing everybody that comes in. So from pediatric all the way to geriatric, and you're going to see everything in between. And so you're going to see mother, baby. And so those are, I mean, they may not stay in the ER for very long depending on where you are, because some places there's a smaller ER because it's a smaller town, so you see everything. And sometimes they stay there in the ER for a little bit and then they're sent off to the mother, baby land, and that's okay. But that's one of the things that you can get really good practice in coding, okay? Because you're going to see, there's going to be instances where you're going to have a woman who comes in and she's pregnant and you have to apply the pregnancy codes because maybe they're not going to go off to mother baby. Maybe they can just be treated right there in the ER. So you still have to use that knowledge for mother baby. And of course, you're going to see a lot of accidents, okay? A lot of accidents. I mean, all kinds of accidents. So injury coding is really going to come into play. Before you get scared, though, on the injuries, here's something that you got to know. Injuries are not that difficult. You just have to know what's happening. Because sometimes people will say, this person has a non-traumatic tear, right? And so if that's the case, then that means non-traumatic means that nothing happened to the patient. This is an organic condition that happened, which does happen, okay? And then there are, well, this was a part of an accident. Somebody hit them, they got struck by something that was flying through the air, they fell, you know, so you need to see some type of action in order to figure out, okay, what's going on with this patient, okay? And that's all part of interpreting the documentation and getting exposure to different scenarios like that. While it may be a little bit overwhelming at first, that feeling is only temporary. And this is the thing that I hope this part of the message gets to people, is that these feelings of being new, of being unsure, of being like, oh my gosh, what did I just do? What did I get into? If you're getting hired to get into these positions that have all of these multiple specialties, that means that that place saw something in you. That manager, that hiring manager. And even if they say, hey, look, we're really desperate because we need people, and they hired you because you applied, it still doesn't matter. You're still going to get something from this experience, which is getting a wide variety of knowledge. And with this wide variety of knowledge, you're going to be able to go anywhere. You can literally then write your own ticket. And you will find out, because you have had exposure to all of these different specialties, and you wouldn't be able to say, oh, well, I don't really like to do that, and not ever have experienced it. You will have experienced it, okay? So then you can take all this experience that you've gotten from coding for all these different specialties in the ER, for example, right? And then you can go forth and say, you know what, I really like ortho. Let me go and code for ortho. Or, you know what, I really enjoy doing the cardiology. And maybe you become a cardiology coder, like, because you want to go apply over there. That's totally fine. So those are options that you'll have. But keeping ourselves small and going into places that are quote unquote easy, okay, even though nothing in coding is really easy, but you do end up with some things that are repetitive, and that is always possible. And plus, it all depends on how the provider documents too. But there's things that, again, you can learn on your own by practicing with workbooks and by getting exposure through work. But you're never going to get there if you look for places that are quote unquote easy. And trying to be easy on yourself right out of the gate is also a bad idea. Because if you say, well, I'm really overwhelmed and I don't want to do all of that, you don't know what you don't know. You still have to learn in HCC if you started with that, okay? Which I always tell you guys is a temporary stay. HCC, risk adjustment coding, is just diagnosis coding, right? And although people have said, well, there's procedures in it too. Okay, whatever. The majority of it is just diagnosis coding, right? And that's typically what it is, diagnosis coding. But people get stuck there. And they get stuck there and they end up staying for years. And then they panic because they want to get out because they're so bored and they don't know what to do. And now they can't get out because they forgot everything about CPT. They forgot everything about ICD-10 PCS. They forgot about modifiers and E&M. And so again, now you're back to square one. And there's some employers that will not count HCC as experience, any risk adjustment coding as experience. I've seen the job listings. I'm the one who looks at the job listings because it's part of what I do as a content creator here on YouTube, is to make sure that I know what I'm talking about when as far as these employers and what they're looking for. Okay, the employers are always going to be looking for well-rounded coders. So coders who are coming from oncology experience, because they know that is notoriously tough coding, okay? And coming from the ER, okay, this is a person that can not only go into the wild, wild west, but they can manage and they can like switch their brain on and off. And you may not feel that you can do this or that's not something that you want to do, but trust me, after a while, if you just give yourself a chance to be in there, you will see the difference even in yourself, okay? Because we need to give ourselves the opportunity to be challenged. And the ER is one of the best places to be challenged, okay? And everything that you need to learn about the ER can be learned from your books, from your coding manuals. And being in the ER for a few days, you will actually start to see a pattern of what is most common there, okay? What comes in a lot, okay? If it's injuries, then we know we're going to have to look over those injuries. If it is a lot of geriatric patients that go in there, then you know you're going to have to look up that stuff too, okay? Because there's codes that really do affect the geriatric population, and that's something that you're going to have to learn, all right? But everything just takes time. But like I said, ER is one of the best places to work. The next place is family practice. Not as high stress as the ER, obviously, because it's a little bit toned down. We've got, appointments and things like that for family practice. But again, family practice, you see everything. You see injuries, you see well woman visits, you see even sometimes well baby, depending on the size of that area and things like that. You can get that kind of coding in family practice. And you'll see the sports physicals when the kids go back to school, and there's the sports physicals. Those often happen at the family practice clinics, because sometimes they have like a weekend clinic where it's all nothing but sports physicals right when the school year starts. So that's something that, okay, this is a little bit more repetitive, but on this day, because you're going to get those breaks in between, the repetitiveness. But it's also giving you variety, because then it's back to the grind on Monday. And what are we seeing today? Are we managing a patient who's got lots of chronic conditions? Are we seeing patients who, are, hurting themselves as far as like falling downstairs and things like that? Whatever the case may be, we can see that in family practice. Okay, so you see young to old in family practice, and that's a great place to be. Okay, it's a fantastic place to work. And yes, while some of it is not as intense as the ER, you are going to see some procedures where people are going to get confused about what's going on. And the best coders are going to know how to distinguish the differences between, like, it's a preventative visit, right? But there's also an E&M going on. And if you know how to do that, oh, trust me, that is the best thing for those providers, okay? When you know how to do that. Because there are times when it's a preventative medicine visit and an E&M will not apply. It's just going to be the preventative medicine visit, right? But there's going to be times when an E&M, a separate E&M will apply. And you're going to need to know those types of things. So coding for family practice is a great place to get all of that experience. Because again, you're going to see all the different types of things that happen in family practice. And that's going to let you use that position to be a springboard to your next position if you want to go someplace else. And I do recommend moving around. Even if it's there at your facility, that's fine. But getting exposure to a lot of different places is fantastic, because that's what's going to give you those coding chops to be really good at what you do. Because it's not so much that, oh, well, I want to be a specialty coder in cardiology, okay, well, that's great. But at the same time too, what happens if you want to try something else? That's how you avoid burnout, is by giving yourself the opportunity to say, hey, I can code anywhere. So for me, in my example, I am an orthopedic and podiatry coder. That is where I primarily sit right now, right? But I can go anywhere. I have proven this more than once, because I started, when I started here in my forever home, I started in inpatient professional services, which is my next one to recommend. Inpatient professional services is when, the best way that I can explain it is when a patient is in the hospital and they have been admitted by the internal medicine team. Okay, internal medicine team is doing their check of the patient, and then they see, oh, well, this patient is a diabetic and they have what looks to be a foot ulcer on their foot. Let's call up podiatry. So ring podiatry. We have a patient up here who could use your assistance. No problem, I'm on my way. Podiatrist goes up, checks out the patient, sees the patient. So now you have inpatient professional service. This outpatient provider has come up to the floor to visit this patient and care for them. So in your CPT manual, obviously you'll see the inpatient hospital initial, you'll see the subsequent, and you'll see the discharge codes for inpatients, all right? And that's the E&Ms that you're going to be working with. Now, for inpatient professional services, you're seeing everything, okay? And everybody. So again, when I came here, my ticket in the door here to my forever home was the fact that I came from my second job, right? That I had gotten. I had worked there for inpatient professional service. Now, when I very first got to my second job, because I started off at the Cancer Therapy Research Center, and then I went to my second job. And at my second job, they said, okay, can we put you, they were doing clinic assignments, okay? And so they had given one of the girls, she was going to code for, I think she was coding for mother baby. And then the other coder was going to code for family practice. And then they got to me and they said, would you mind coding for inpatient professional service? And I'm like, it's fine, whatever. And they go, no, we gotta tell you something. And I'm like, okay, what? And they go, we haven't been able to keep people on because this is It's inpatient coding, but it's outpatient coding, and a lot of people get confused. So this is what we have available. We really need somebody, but we can't keep anybody in this clinic. Are you up for this challenge? Because if not, then, we need to find somebody else. I said, I just moved here. I moved 8 hours away from my hometown. This is a no-fail situation. So I will be here, and this is totally fine. I can do this. And so without fear, I stepped into this position. And that's the exact same way that you should be. And it's the fact that I did not know to be afraid. I did not know to be afraid. I did not have that filter on my head, be like, oh, okay, yeah. Oh, no, I can't do that. I'm going to try to do the easiest one that I possibly can. No, this takes effort, and it takes grit, and it takes endurance. You don't understand something, you got to look it up. I was very fortunate that, of course, I'm a reader by nature, but I had a wonderful boss who is now my friend, my Jessica, who I love and adore because she is the best. She is awesome at what she does. And even though she will not admit it, and she says, Blue, no, I don't really know all that much. No, she knows, okay? She is who I go to when I have an issue. Because you can't just go to anybody when you have a question about coding. You have to be very careful about who you ask, because you can get yourself even more confused if you're asking somebody who's already confused. Whenever I reach out to Jessica and I have to ask her the question, she breaks down. She's like, I saw something in coding clinic about this, or I saw something in CPT assistant. She has this fantastic memory that she just remembers stuff by reading it. I have to read it in order for me to get it, but she'll remember stuff. She's got one of those quirky memories. But she was able to back me up when I was first learning. So she trained me, she ran through with me, and I'm like, this isn't hard, The thing about it was there was such a high volume of inpatient professional services that had not been coded because they could not keep anybody in there. So I was able to work tons of overtime, which was fantastic because you get obviously more time to learn and obviously very nice checks. But that was my experience working for inpatient professional service. And the way that the electronic health record was, I was able to learn all these different specialties, right? Not only that, I was able to learn the electronic health record and then set it up to where it was more convenient for me to hit a lot of these encounters all at one time. So that way I was able to knock out a bunch of them. And that was just a matter of learning the system and learning how to use it properly. So that was a very good thing for me because, like I said, all of that experience I was able to put onto my resume. I was only there at my second position for 8 months, and then I was able to secure my position here. So I had less than 1 year of experience when I got here to my forever home. And being here at my forever home and coding for inpatient professional service, again, I have to use many hats and have to be able to code for all these different specialties. I had to code mother baby, I had to code for the ICU, I had to code for all the specialties, psych, not behavioral health, but I did psych, I did cardio, I did urology, I did neurology, I did pulmonology, I did all of these different specialties, which help to kind of have all that in your head, right? So then I bounced around to a few other different specialties after I left inpatient professional service when I was here. I left inpatient professional service to be in another clinic. And so I went to behavioral health. I did TBI. So now I'm racking up all this experience. And again, you do this by going into something like inpatient professional service, okay? You will see those in the job listings listed as professional fee coding, okay? I'm looking at the clock because I have an appointment I gotta go to. That's how you look for those, okay? And then when you're looking at those pro fee job listings, they're going to tell you candidate must know this specialty, this specialty, this specialty, or they may say it's multi-specialty. Those are the ones that you want to get with, because again, those that get with those multiple specialties in the beginning from Jump Street, those are the ones that later on is going to be like nothing for you to get through anything. And you know what sharpened my experience as not only just coming from inpatient professional services, and then being okay with going to different specialties and being put there, what else sharpened my skill was when I worked at home for a level 1 trauma hospital. I worked for a level 1 trauma hospital, and I did same day surgeries. I did a lot of outpatient clinic encounters, but a lot of what I did was very challenging coding. So you want to look for a place that is going to be challenging to you. And I even said to my boss for my job, her name was Trish, awesome lady. And she said, I told her, I said, this is like the Marine Corps of coding. And she's like, what? And I said, no, I'm serious. The production standards, which were high, for the specialty that I was doing, the production standards are high. The documentation is challenging, but it is good. Like sometimes I'm in there and I'm coding it out and I'm like, wow, that was pretty good, and you think about those things, right? Because then it starts to make more sense to you, but it's never going to make sense if you don't give yourself the opportunity to get that exposure. And so I've always said that because of my experience working for that level 1 trauma hospital, it was like the Marine Corps of coding. So I'm never going to be scared of nothing. And it's true. I've never been scared. I've never been scared. Even before that experience, I was not scared. There's just going to be a time when you're going to be learning things, okay? And it is okay. Everybody falls down. Everybody gets back up. But it's about the determination that you're showing by getting yourself in these positions instead of trying to look for the easiest position. Because again, you're not going to give yourself the opportunity to advance as far and as fast as you can if you are holding yourself back looking for minimal effort positions. Okay? Not that even repetitive places are minimal effort, but some of them do get to be minimal effort. All right? And you would have a lot more fun in your career by giving yourself that regular challenge, okay? And then you're going to be the expert that people look for after a few years if you do that. And if you ready yourself that way, okay? And don't ever let anybody tell you, oh, you just work in the ER. Well, the ER does everything, oh, you just work at family practice. No. Family practice has to know a lot too. It's just like family practice doctors. They've got to be able to know everything, a little bit of everything. And it's the same thing with their coders. They're going to know a little bit of everything too. Okay. So with that said, the final place that I will say for you to try to apply is a children's hospital. Now, you may be thinking, children's hospital, Blue? Watch this. So with children's hospitals, right? These are pediatric conditions, and some of these are, congenital conditions. So sometimes in these pediatric hospitals, they're doing new procedures, and procedures that there's not even a code for yet. So who's going to learn about that? Who's going to learn about that type of coding? You, if you're working at a children's hospital. Because there are things that affect children that do not affect adults, and being able to understand pediatric conditions and diseases and the things that happen to them and the procedure codes, especially those procedure codes, that's going to help you. And please, somebody who can put onto their resume that they have experienced coding for experimental procedures, tell me that that's not going to be impressive. I'm just saying. So with that said, I'm going to go ahead and wrap this one up. Best of luck to you all out there. Remember, give yourself a chance to be challenged. Please, whatever you do. And you will thank me for it later, okay? Because trust me, everybody else is going to be wanting to run away from those challenging positions. But you, if you go in there full force and you're like, you know what, I'm going to try this. I'm going to do this. Guess who's going to have more opportunities? And guess whose earning potentials is going to go up? I'm just saying. So with that said, I'm going to wrap this one up. Thank you guys so much for joining me. If this video helped you, please like, subscribe, and share. And I'll see y'all next time. Bye.